about core work from all sides of the body, not just the front. So I want to show you one of the other ways that we break up categories of core work, and specifically how we can use the wall to hit all of those categories. The first one that I want to break up is kind of focusing on the upper core versus the lower core, and the position that you go into is going to have an impact on that and the way that you use your props. So if I want to use the wall for stability, this is one of the things that I really love about using the wall for core work, is you get this upper core stability by pushing the hands into the wall, and then you can focus on lower core movement and control. So I push the hands really strongly into the wall. That tucks my bottom ribs down, engages the upper abdominal area to create stability. It's holding and preventing movement here so that I can isolate and focus on the movement in the lower leg. Okay, pressing the palms into the wall, and then I'm going to start to rock. And I can't really go that far with this movement. It's quite challenging to keep control, especially pushing the opposite hand into the wall. And then I'm going to start to hinge forward and back. Really, really isolated. Okay, and then I'm going to do one of my favorites, which is the reverse crunch. I'm trying to lift my pelvis up, keep that squeeze in on the block, keep the pressure into the wall. Okay, so now I'm going to switch my orientation to the wall. So I'm changing the part of the body that's being stabilized. I'm going to put my feet onto the wall in our 90-90 position. Like that. Okay, so now the wall is helping me to keep pelvic stability, and I'm engaging the feet into the wall. They're not just kind of resting there, I am pushing, and I immediately feel that start to activate my lower abdominal muscles to keep stability and stillness there so that I can focus on movement in the upper part. I'm going to squeeze into the block as well, and I'm going to start with a little upper body crunch up to the knee, really controlled on the way down. Feel that changing the shape of the spine. And then I'm going to go for a little bit more of a rotation past the knee. And past the knee on the other side. Okay, and I really feel that right up in the upper abdominals. So now I'm going to swing around to the other side of the wall, and I don't need the block for this part. It's kind of the same position that I was in before. And now we're going to look at the difference between ipsilateral movement, moving the arm and the leg on the same side, versus contralateral movement, the arm and the leg on opposite sides. It's going to accomplish different things. So I like to almost have my head, the crown of my head into the wall when I'm using my arm stability position, like that. I come up to 90-90. Okay, so now I'm going to start by doing same leg and arm, where I'm going to stretch the leg out and take the arm away from the wall. Other side. Keep the opposite hand really firmly pushed into the wall. And then you're just going to switch and do opposite sides. Okay, so arm and leg, opposite sides. And I'll add one more variation to that I really like to do. I'm going to press on the knee. So you can do this with the same-sided movement or opposite-sided movement, that ipsilateral or contralateral. I like to usually do this one on contralateral sides, my right hand, my left knee, and then I'm going to move the leg. Palm stays pressed into the wall. So I'm pushing here, I'm pushing with the knee into the hand. I could do a straight-legged version. Or play around with any other variations of that leg movement. Circles, open and close, side to side. Really challenge the body's ability to stabilize and keep that control.